Hello and welcome to Bradford for Better TV, the platform that brings you real people, real issues from real Bradfordians or people who are working in Bradford. We try to make this as interesting and informing and educational as possible. And today we've picked the issue of air pollution and in particular the Clean Air Zone. I'm your host, Shahid Islam, who's the Vice-Chair for Bradford for Better. This is the first time I'm hosting, so any rookie errors, sorry, on my part. Today, you are served by a fantastic group of panelists. I'm just going to introduce them one by one. So we've got Professor Rosie McEachan, Director of Born in Bradford, also visiting professor at the University of Bradford, visiting professor at the University College London. Then we've got Dr. Jim McQuaid, Associate Professor at the University of Leeds, atmospheric climate scientist. And then we've got Sally Jones, who is a pollution control officer with Bradford Council. Welcome to everybody.
Thank you.
Sally, if I can start off with your good self, please, and start off by asking, what exactly is the Clean Air Zone and where does it cover?
The Clean Air Zone is actually, in reality, a ring of camera network, a ring of cameras that goes round an area that we need to protect because it's got too high pollution within it. The areas that it includes are the outer ring road and itself, and then everything inward from there to the city centre, and also a corridor up towards Saltaire. So the Manningham Lane and Canal Road corridor up to the Saltaire junction. Okay. It can be seen on the website if anybody wanted it in a lot more detail. That goes right down to all the individual streets, but that's the bulk of it.
Yeah, so we should really add a web link to this point. If I can just ask you, what will happen to just anybody who's driving in the Clean Air Zone, just normal drivers who are perhaps not part of a business?
Okay, so it really depends on the kind of vehicle that you drive. So a quite small fraction, it's less than 5% of vehicles, are commercial vehicles. Now, they can be driven by people as a private van, or it might be a camper, or so private people do have them. But those commercial vehicles, the much older ones, are the ones that we are targeting. Those vehicles, although they're quite a small fraction of the traffic, are actually contributing a lot of the pollution. So that's why we're trying to keep those older vehicles out of that area.
Yeah, Sally, it's right, isn't it, that passenger vehicles are like people's normal car? Are they part of the plans or are they not part of the plans?
No, they're not part of the plan at all. Passenger cars aren't included and won't be charged to come into the zone. But what we are saying to people is to be mindful that we've got this problem. And if people can use other ways of getting around than their own individual car or dirtier, older vehicles, that they try and do something about that and help us deal with this, because it's a health problem for a large part of Bradford.
Okay. We might come back to that passenger point a little bit later, but just in practical terms then, Sally, from the day of the switch on, which is going to happen this month, we're in September, yeah. What will it mean for businesses, in a practical terms, for businesses such as taxis and ice cream vans and lorries? What will they be doing different now?
So all our businesses and taxi drivers, and we've got really high levels of awareness in the city, and they've all been working towards getting ready for this date at the end of the month for a good 18 months now. And there was a survey done recently, and they said we've got unprecedented levels of awareness in Bradford. We've done really well in getting the message out. Over 90% of people know about this now. And what we've been doing is working with them, getting funding from the government out to those people to help them upgrade their vehicles. When they get these newer, cleaner vehicles, they then aren't affected. They can go about their business as usual. We've also been processing exemptions for residents and businesses that aren't able to upgrade. We've been able to give grants, but it doesn't cover the full cost of upgrading. So those that can't take advantage of those grants have been granted exemptions for those businesses and people within Bradford.
Okay, there's one comment that keeps on coming up in social media. What will happen to people who are, for example, delivery drivers for Uber Eats or Deliveroo? What do they count as?
It depends what they drive. So it really is not about what you're doing, but the vehicle that you've got. So if you're delivering Uber Eats in a truck and it's an old one, it might apply to them. If they're registered within Bradford, they may be able to get an exemption for that. But it's not really the activity. It's the vehicle that's what's picked up by the DVLA, and it's on the registration, and that's what determines whether that vehicle's relevant or not.
Brilliant. Okay, on to a little bit of the science
Shahid,
now. Yes.
Just on that, it's a bit like road tax. Road tax is charging the emissions of the car. So a lot of people think road tax is, you know, more complicated, but it's simply based on the emissions. That's why the bigger the car, the more emissions, the higher your road tax is. So that's another way of thinking about it.
So it's the same principle as road tax. Okay, that's useful. So Jim, I was going to get onto the scientific side of this now. So when we talk about air pollution, what exactly are we talking about? Tell us about what's going on. What are the compounds? What are the gases? And how do they affect and interact with our health?
Well, as a scientist, the first thing I'm going to say is it's not simple. It's complicated. For example, petrol alone is made up of 20,000 different individual chemicals. So I did a chemistry degree. So there's, and then they go into the atmosphere and they react and things like that. So, but the main things we talk about these days are nitrogen dioxide, or NO2, and particulate matter. So although they're both air pollutants, they have different sources. So nitrogen dioxide, the major one, source is road transportation, and clean air zones predominantly are directed to reduce nitrogen dioxide. And we saw that during lockdown, because when we basically turned a lot of the traffic off, the nitrogen dioxide levels fell very, very quickly, you know, across the country, including Bradford. But when the traffic started, we saw that gradually increasing again. The other source, the other main air pollutant that we also look at is particulate matter. So this is you see it out of, you see the smoke coming out of the back of cars and things like that. That comes from cars, but it also comes from things like wood burning. So there's lots of different sources. So just showing that, you know, it's a complicated picture, and we have to make lots of these different measurements. Traditionally, people thought about sulfur dioxide, but that's in the day when we had coal fires and produced a lot of sulfur into the atmosphere, but that's much less of a problem these days. It was sulfur dioxide that led to the formation of acid rain, if people remember back that far. And also one thing that we spotted, or we know from heat waves, is there's another pollutant that becomes more and more important, and that's something called ozone. But ozone's not emitted by vehicles. It's one of these things that is produced when the chemicals in the atmosphere react, especially in strong sunlight. And ozone's an irritant on the human body, so you know it exacerbates breathing problems and things like that.
Really helpful. So Jim, if I can, I know it's a complicated area, but another simple question. How much of the air pollution that we've got in cities like Bradford comes from motor vehicles?
Well, the other thing I didn't include in the complexity is that is that we have to take the weather into account. So if the wind's blowing, because Bradford's in a bowl, you can think about the pollution being sort of pushed out by the wind. It just naturally ventilates. But if there's very low wind, the pollution just builds up in Bradford. So Bradford, unfortunately, you know, its geography, it is in a bowl, so the pollution can accumulate, particularly in places like Bradford. So it can be, and it's, you know, we have to include weather into the our thought process. But we can, you know, and you know, the cars are coming into the centre of Bradford in this pool, in this hollow. And that's where the emissions do build up. So cars are a large source. If the wind's blowing from a distance away, you know, every you know, a few times a year we'll get Saharan dust. So that's a really nice example that pollution can blow a very, very long way when we get Saharan dust arriving in Bradford and across the UK. So it's dependent on the weather as well.
No, that's really interesting. So what you're describing there, visually, I'm thinking of a bowl, and so we're sat in there, and the air pollution that we've got in there the wind blows over this bowl and everything stays as it was within this bowl. So we've got this toxic mix of this air not getting out. Is that what you're suggesting?
Well, if there's no wind, if it's a very still day, across the north of England, there'll be no ventilation. So, it's not the separation. If you've got wind blowing over the top of the bowl, it generally will divert down into the bowl. But if it's very still, we'll see that. We saw really a good example of the effect of wind. If you remember the tyre fire, almost a couple of years ago now. So I came over in the evening to go to that fire, and the smell was very, very strong. From the people, I'm sure the people who experienced that. And when I was back in Leeds the following day, about 2 o'clock in the afternoon, suddenly I could smell that smoke because the wind had turned round and it had blown straight from the fire, which burnt for about a week, straight in a straight line all the way to the university in Leeds. So that just shows that the transport of this, and I wasn't using any, clever sensors or anything like that. I knew the smell of smoke because I'd smelt it the day before. And that's a really good example of the impact of the weather.
Brilliant. Thanks, Jim. Rosie, if I can ask you, please, to briefly describe what Born in Bradford is before I ask you my next question about Born in Bradford.
You can, Shahid. So Born in Bradford is a research project. It's one of the biggest health research projects in the world. And what we do is we follow the lives of people living in Bradford to find out why some families stay healthy and why other families fall ill.
Okay. And so the question that follows is, what has Born in Bradford research found that is worth sharing with members of the public and our listeners, which is relevant to air pollution?
So we've been doing a lot of research looking at the health impacts of pollution, and that's with families who are living in Bradford, but also families who are living across Europe. And it became, clear really early on that pollution is one of the biggest causes of ill health, not only in the population in Bradford, but globally. So we've shown with families living in Bradford, we've shown that high levels of pollution when mums are pregnant can impact on the birth weight of babies when they're born. We've shown that higher levels of pollution are linked to higher blood pressure in children when they're aged 4 to 5. We've shown the impact of pollution on brain development. Oh, John's here too. Come join this podcast, John.
Come on, John.
Oh, yeah.
Yeah, so we're just... Oh, hang on. You want me to you, John?
Qualified doctor.
Yeah,
T-shirt.
we are recording, John. Oh, nice. So we just... Yeah, can you hear John?
Yeah.
Yeah.
Okay. How did the meeting go?
Oh, we can edit that bit out.
No, it's good. He does that all the time.
Yeah, for our listeners, this is what it's like working in our institute, never a dull moment. So I mean, I think we've shown the impact of pollution on a whole range of health outcomes in our city. We think that our research has indicated that 1 in 5 children report having problems with their breathing, and we think that around 30% of all children's asthma cases in the city are due to air pollution. So due to the, all that muck and filth in the air that we're breathing. So it's a really big issue.
Yeah, that's really interesting. I remember Jim was on Look North not that long ago in one of the schools, and he asked the children, how many of you've got asthma? And all of them put their hand up, and it was a big crowd. Rosie, I was just wondering, when you mentioned lower birth weight detected amongst children when they're born in areas with high levels of pollution, why is that significant? What does lower birth weight indicate?
Yeah, so low birth weight is is an indication of health issues that a child may have later in life. Low birth weight is when a child is born below the level of 2.5 kilograms. And what we find is that children that have a lower birth weight when they're born, later on in life, they might be more likely to suffer ill health. And this might be when they're 50, 60, 70 years old. So it's just one of those measures that we use to sort of think about, right, how healthy is an individual going to be across the life course, across their life. But it's really important to say that it doesn't mean every child born with a low
Yeah.
birth weight is going to be ill. It's just when we look in the whole, across the whole population, it's one of those measures. It's
Really
important.
helpful. Really helpful. Sally, if I can ask you to tell us a little bit more, and this might be in addition to what Jim had said about the geography of Bradford, but why is there more air pollution in the inner city of Bradford, and which is why it's bringing in the clean air zone there, compared to, say, somewhere like the outskirts of this district?
Sure. So it's basically just to do with the amount of activity going on. So every time anything's combusted or burnt, any type of fuel, be it gas in a boiler, diesel in a car, or fuel in a factory, or any type of activity like that produces pollution. So when you've got a lot of things going on in a concentrated space like the centre of Bradford, you get more pollution. It's as simple as that. And I think a lot of it is because everybody's heading into the city centre in vehicles, in and out every day, and you're just getting a lot of vehicle movements and high pollution. Yeah, and Jim's point there about buildings blocking the wind and weather, those sort of physical things make a massive difference, and we found that through our monitoring. So where we've got streets with big tall buildings on either side, it traps the pollution in, and the wind can't do its job of dispersing pollution, and we get really high levels then. So yeah, the buildings make a big difference.
I think what's also really important is that when Sally's saying, we've got areas of the city with much higher pollution levels, they are also parts of the city where we have high levels of ill health as well. So, it's a double whammy, I think, that people living in particular parts of Bradford are experiencing. So just sort of generally where there's higher levels of ill health within a particular area, and then on top of that, they've got higher levels of pollution, which is just, making things worse. So it is really important to do something about it.
So yeah, that's another thing, Shahid, that because everybody wanted to be able to get to schools, they tended to be on those big main routes, and they're right near the roads. And probably back when they were designed, we didn't realise the problems associated with that. But what we've found with the clean air zone is the biggest improvements are actually at schools and in our more deprived areas. So that is a good thing that we're looking forward to that improvement for.
Fantastic. So if I can just ask then a question which follows from that, Jim, you might be the right person to answer it. Where air pollution is reduced, is there any evidence it leads to improvements in health? I mean, is there any examples from anywhere else that we can draw on for that?
Yes, there is. I mean, we have to think about it in, again, you ask a simple question and I come back with a more complex answer. So we've got to think about, there are two ways of thinking about how people deal with when they're exposed to air pollution. And one's the chronic effect, and the other's the acute effects. The chronic effect is sort of the long term. So that's where people's, their health and these are the things where, the big data set is going to be absolutely fantastic because it shows people's health over a long period of time. But there's also the acute impact, and we can measure that by just looking at looking at the A&E data, ambulances and things like that. So when people have an asthma attack, a really bad asthma attack, and they need to go to hospital, they need to get an ambulance, we've got that data as well. So that's a lot quicker to get at. Obviously, that it takes a few months before it can come through to our team. But the sort of chronic impact takes a long period of time. But you have to invest in that, and that's what the Born in Bradford project has done. It's looking at the health since the cohort was born and watching them grow up. So that's why it's a very long-term thing. Sally?
Can I just add something to that might be useful for listeners? One thing I keep getting asked about is these pollution forecasts that show that pollution is low in Bradford. And what those are telling people is that it's that low that day that you don't need to take special preventative measures. It's not going to affect your health that particular day. It's not so high that it's going to cause an asthma attack now. But over a period of days and months and years, the higher levels that are there are causing the chronic effects that Jim talks about. So those pollution forecasts, when they say low, they're talking about just that day. It's quite a difficult concept, but what they're saying is you don't need to kind of shelter in your home today because pollution is that high. And we do actually get periods in this country where it's so high that actually just going out and taking exercise can be harmful for people. That's what that system's for. It's to let those people know about when it's really, really high. But what that doesn't do is take into account these longer term averages that are also causing these chronic effects and ill health. So that's just a useful thing for people to understand, although it is quite complex.
That it is really helpful, and I think it's like when you look at some of the figures in the city, it's really quite shocking. So we know 500 deaths from respiratory related disease every year, something like 41,000 cases of asthma. And if you think about pollution, probably it would be really quite a major contributor to that. Then I think what we're hoping to see with the Clean Air Zone and that driving down pollution is that there's going to be less kids with asthma, less adults with asthma. There's going to be less people turning up at accident and emergency, having problems with their breathing or with their heart. And that is fundamentally going to, it's going to help the economy, because we're not going to be spending as much treating the costs of preventable illness, because a lot of the pollution related illness is entirely preventable, and we spend an awful lot of money within the NHS treating that. So hopefully within Bradford, we're going to show, as the pollution levels come down, that there's less of a burden on our NHS, on doctors and nurses and people trying to do their best to keep families healthy.
That's really, really helpful. If I can slip slightly away from the science and move a little bit towards the politics of this, if I may. Sally, you will be aware that many people have echoed concerns about the Clean Air Zone. Some have even described it as a money spinner rather than holding any real concerns for improving people's health. I just want to put that out there because it keeps on coming up in various social media groups. How would you respond to that? And I'm thinking there are lots of people who've campaigned and put petitions and have protests outside town hall. How do you respond to that?
So what I would say is that the best Clean Air Zone wouldn't take any money off anybody. Mm-hmm. What that Clean Air Zone would do would mean that those older dirty vehicles didn't come in. The charge rate is set at the lowest it possibly could be that would discourage people from coming in. So it's what we're actually saying is we don't want you to come into this area with these older vehicles. We aren't saying that we want the money from you. But there is it's the only way to do it without completely shutting the road to all the other vehicles that can come in. That's what the charge is about. So in an ideal world, everybody would have upgraded their vehicles or made alternative arrangements for coming into the centre of Bradford, and we wouldn't actually have any of these older vehicles to charge. It's really difficult, but we do need to make arrangements so that people can come in if they really need to, and that's what the charge is all about.
Jim?
And just on that, I mean, we saw, like I said before, when the lockdown came in, the traffic slowed down, or the amount of traffic decreased rapidly. There were still deliveries and stuff to get to supermarkets and things like that. But there are studies, and these things take a while, where they're already looking at the health impacts of that, so we can calculate the cost to the saving to the economy, because people weren't suffering from excessive levels of air pollution. So we're always looking at this. So it's a very long-term issue that we're doing, and the project that we're all involved in is a long-term funded by the NHS, because they know in the long term that reducing pollution, like Rosie said, is actually going to save the NHS money, and saving the NHS money is saving the economy money. So it's a very long-term plan. So it will, it can hurt initially, but when I've spoken to people in Bradford and said that, some of the data that Rosie's team have got showing that how big a fraction of the kids with asthma, and that's from air pollution, they've been quite shocked. So that's a very simple message that I tell to people, and they very quickly come round when they realise that the impact this is having on children, and particularly children, because they're developing, they're growing. Now is the time for us to be reducing their exposure, because it's going to have long-term benefits for the rest of their life.
Just to say on that, Shahid, so we've already know that we've got 92% of our taxis are now cleaner. All of our commercial bus fleets are going to be clean. And companies that do come into Bradford with older vehicles, they've got a big fleet, they've got cleaner vehicles within it, and they're making arrangements to send the cleaner one to Bradford. So we know that it's going to really improve our air quality in those kind of ways.
I think that's really important as well, because there's a lot of talk about the clean air zone and that switch on date and the vehicles that are going to be charged. But what also has happened in the city is because we've had that clean air zone sort of directive and that push from the government to put something in place, that's meant that loads of other investment has come in. So like the buses are cleaned up. As Sally said, loads of taxis are upgraded now. And that's brilliant. That wouldn't have happened without that focus on driving down pollution. And I think the other thing I just wanted to mention is that, in our Barn and Bradford project, we're also, in addition to health, we're also going out and talking to families about what they think about air quality within the city and what they think about the clean air zone. And we did a survey just sort of at the back end of last year, just as things were starting to happen. This thing about pollution was becoming more well known. We did a survey with our Barn and Bradford families, and we had over 1,100 responses. And those families, 70% of them said they were in favour of a clean air zone. So I think it's really important to have a bit of balance. I think we often hear it's important to understand the how people feel and the cons as well. But sometimes in the media, I think it can be very one-sided because it's a good news story. But we have to have a bit of balance. There's lots of people that think this is a really good idea, in addition to people that are worried about it and think that maybe it's not such a good idea.
No, and it's really helpful that you're bringing those figures to sort of balance this narrative a little bit. And I think one of the other things that I think you may have heard a lot about, and it's worth me just sharing, many people are saying that this is starting off with business and commercial vehicles, but this is a slippery slope in which private vehicles are going to be included next. And I hear that all the time. So I just wanted to sort of put that out there. Jim's got his hand up.
Yeah, just to jump in on that, and a lot of people, because I live in Leeds and I do a lot of work with Leeds City Council. I'm on their air quality and health boards, and we've got a meeting actually next week. And a lot of people will have seen that the Leeds Clean Air Zone was parked. They suspended it, so they never actually started it, and that's because there was so much investment went into it before the Clean Air Zone. And people cleaned up the buses and the trucks that were going in, and so much work was done before. They did future modelling, and it looked, so they said, well, actually, it's gone so well that we don't need the clean air zone. So, in the future that may come back, but at the moment, so the way forward is that the air in Leeds has been cleaned up so much. So that comes back to your question just now. So if we get the levels down, there's going to be certainly going to be no need to add more vehicles into the what gets charged for the clean air zone. And if everything goes well, why do we don't have to keep a clean air zone forever. We just need to get the air clean and keep it clean. And if we can get the fleet to change and people's views on that to change, to understand that. So it's a fairly simple message, but like Rosie said, we've got to get some balance, and you can get some very vocal people, and there's lots of we have to listen to everybody to get people to engage in it. But if the air gets clean, then it's certainly not going to need to increase the number of vehicles that get charged.
Brilliant. That's really helpful, Jim. If I can ask you a question about where we are most exposed to air pollution. So I just wanted you to tell us a little bit more. Are people safe in their cars or walking on the side of the street on a footpath?
You're going to hate me because I'm going to say it's more, if you're driving in busy traffic, right close up behind a vehicle that's kicking out a lot of pollution, and you've got your fresh air inlet on that, you're just going to be literally sucking the pollution from that vehicle inside. So, a lot of measurements have said that, the levels that you're exposed to inside cars is very high. I mean, you're driving in a box that's, surrounded by other vehicles. So, it depends on how you're driving. Hang back from cars. If you're coming up to a a junction, do you always have to sit right behind the lorry? Even a meter or so does make a big impact on how much pollution is coming into the car. Again, a simple thing, when walking on the side at the side of a busy road, think about where the wind's blowing from. So if the wind's blowing from the left-hand side, walk on the left-hand side of the road, because if you walk on the right-hand side of the road, the wind will simply blow the pollution at you. So those sorts of things. And, quite often, if you can smell the pollution's there. If you cross the road and notice that you can smell it less, you're walking down the side of Bowling Park or something like that, I'd always walk the side with the park, with the wind blowing across the park.
Very complicated area. You've added more to it, but generally speaking, it is. Are you saying it's safer and cleaner to be walking on the side of a road rather than being inside a box in which there are trucks in front of you blowing pollution into your car with an inlet in?
It's a generalism, but yes, probably. I'd say that. And also thinking about walking, it's exercise. So there's anything where you're doing a bit of exercise. People have done experiments to look at people cycling and walking in very busy, polluted cities across the world, and you have to spend an awful lot of time exposed to that air before the benefit of the exercise is outweighed by pollution. So if you're walking, there is that benefit as well.
Brilliant, thanks. Rosie, a question for you. So bus fares.
Sally's too polite.
Oh, sorry,
I just wanted to come back to your question there, Shahid, about charging private cars and that being a worry for the future. Just to say that for the Clean Air Zone, we found that we looked at the possibility of charging all cars, because as it turned out, the pollution did need to come down that kind of amount. But what we've done is we've pushed taxis further to a cleaner hybrid standard and been able to meet the legal limit without charging private cars. And one of the reasons that that's a really good thing for Bradford is that it was going to really hurt our deprived communities to be charging cars. And what it also did was actually they took other routes, we modelled it, and they actually made new problems outside of the zone by trying to get and avoid the Clean Air Zone by including cars. So that's the reasons that we wouldn't include cars. And yes, so I know it's a worry for people, but I just don't, our public transport isn't quite good enough, and a lot of people are using cars to get to work and drop their kids on the way, and we know that it would have caused a lot of difficulty for people if we'd have included cars. So we went right out of our way to make sure that didn't happen.
I'm sure your answer, along with Jim's answer, will reassure listeners that that's not on the cards. And I think it's really helpful the way you both described it. And provided some assurance that it's not going to happen. So, Rosie, I was just going to ask, it was in the news recently that bus fares are going down. We're seeing more and more cycle lanes popping up. We're seeing more and more encouragement towards walking to school with the children. Is active travel really the answer to most of our problems in respect to air pollution?
Yes. I'm going to keep it simple.
Keep it simple.
Keep it simple. I mean, active travel, it's one of the best things that you can do because it has so many benefits. So if you can, walk, cycle, or use public transport, there's going to be one less car on the road. You've also got the physical activity benefits that Jim was talking about as well. So it is, if we could sort of encourage a shift change, a really big part of the population in Bradford to sort of just make little changes about how they're getting to work and how they're getting to school. So for example, we know a lot of parents drive kids to school, and I'm a working mum, and in the past I found it really difficult to get my kids to primary school on time, but you don't have to drive all the way to the school entrance, for example. So if you need to take the car, you can drive a few streets away or a few blocks away from the primary school and have like a nice sort of 10-minute walk from that point to get your kid to school. And that means that you're not going to get involved in all of that sort of school drop-off, horrific traffic where everybody's trying to get their kids to school at the same time. And if you are able to take the bus to work, you could get off the bus a stop earlier, get a bit of extra time walking into work. So there's lots of little things that we can do. I do think Bradford, for those of us who try to cycle around Bradford, and those who do it, bravo, it's difficult to cycle around Bradford. We do need to get a little bit better, a little bit safer, I think, cycling infrastructure, and it is difficult to go up and down the hills. I think we also, would help if we had more buses. I think it's the Mayor's Fares, which is came in yesterday, capping the price of a ticket at £2, is absolutely fantastic. But we need to get, I think, more buses, because you can get into Bradford and out really easily, but it's quite difficult to get around, the side of it, or from one side to another without going through the centre. So then we've got a bit more work to do there, really.
Yeah, Jim.
And obviously, as Rosie says, the active travel, idea is fantastic. And the more people that use buses, the more buses will be put on, the more people that cycle. As the kids are cycling and things like that, there'll be more investment into the infrastructure, because obviously, if people, councils and local authorities will invest in the infrastructure if it's keeping the traffic off the roads as well. And one thing we haven't mentioned at all is the impact on climate. So, we have this huge, air pollution is something we're dealing with now. Climate is something that we, only really pops up, every so often. Especially in the very complex world that we live in now. But all these cars that produce air pollution, all air pollutant gases are also climate gases. So there's a word that people refer to as co-benefits. So if we're reducing air pollution, we're also moving towards the net zero aims that we have to have, for the entire planet. So there is that benefit as well. But in the short term, the health benefits of reducing air pollution is one of the key things we should be thinking about.
And that's a really important point, given that the droughts that we're experiencing here in the UK and the floods that we're seeing in countries like Pakistan make this a very important point to underline. So thanks for sharing that, Jim. If I can ask any of you to highlight a web link or anything that members of the public can check air pollution on. Is there anything that's available that members of the public can just go on and see air pollution in their areas?
I'd say Breathe Better Bradford, put that in a search engine and it will take you straight to the council's Clean Air Zone site, which should give you a lot of information. We've also got a contact centre line with people sat there ready to take questions on the Clean Air Zone specifically. So do get in touch if you've got any queries.
Yeah,
and as part of our
purple monitors that you would place.
So as part of the Bib Breathes project, we've got a number of low-cost sensors. So these are not as they're not the validated, expensive maintained ones like Sally and the council have. They're sort of low cost. They're about £250, and we've got them deployed around the city at some of our schools. And you can just find them by looking for purple air. So if you do a web search on purple air, and that simply takes you to a map so you can zoom in on Bradford. We've also got some in Leeds and we're expanding this network. They are spot measurements. So, they are at schools. So one thing that Sally said about the air quality forecast, they're often quite, they're average for an area. So an air quality forecast that is showing, a low levels, it still might be high at the side of a road. So it's the common sense. If you can see lots of cars, that's a good sign there's lots of pollution. So things like that. But if you do a search simply on purpleair.com, and that's got a map so you can navigate to Bradford. And the children in the schools in our study, they look at this data because the sensors are right in their playground, so they can see that. So you can see that, and that's real time.
Brilliant. Thank you for that. We'll put the links in the podcast and people can access it via there. And there we have to leave it. A special thanks to our guests, Sally Jones, Rosie McEachan and Jim McQuaid. I hope you found this podcast really useful. If so, please subscribe to the channel and share this material with other people who may find it beneficial. Please also feel free to participate by adding comments in the link with this podcast, but do please keep them polite and respectful. Thank you for watching from the Bradford for Better team. Till the next time, goodbye.